Hey, and welcome to our BreatheRight program. So today, specifically, what we're going to try to do is just give you a little bit of education and just give you 3 exercises to help manage your breathing. So without further ado, let's get into it.
The lungs are a part of the respiratory system that work together to help you breathe. The main function of the lungs is to move fresh air into the body and to move waste gases out of the body. COPD, or chronic obstructive pulmonary disease, is a long-lasting lung disease caused by damage in the small airways of the lungs, which makes it harder to get air in and out.
So today we're going to be doing some deep breathing just for this specific exercise. And with this exercise specifically, what we're going to have you do is get into a nice postured position where you're trying to open up your chest. And by doing that, you're just going to sit nice and tall, and you're going to bring your shoulder blades back and down. Really try to just open up your chest as much as you can. Doing a great job, Jess. So now what we're going to do in this position is try to just breathe in very deeply for a long time, about 5 seconds. And really just trying to pull that air in, and then once you get to the top of your breath, try to exhale and push it out for twice as long, and then just try to do that about 5 to 10 times. Perfect. Now what we're trying to do this for is just try to help bring in more new air and kind of allow that gas to exchange in your lungs. So if you want to progress this and make this a little bit more effective, you can actually try to forcefully increase your expirations. And by doing that, and what I mean with that is actually when you get to the part where you're pushing your air out, you want to kind of just either cough or pronounce very loudly, really pushing on your diaphragm. Alright, I know it sounds silly, but the thing with this is actually you're kind of tricking your body into doing something that's going to produce more pushing out of that air.
With age, the muscles that support breathing get weaker and lung tissue gradually loses its ability to stretch, making the airway smaller. Physical activity can help to reduce the progression of respiratory diseases. Breathing exercises can help strengthen the muscles used in breathing and help train the body to breathe more deeply and efficiently.
Okay, so for this exercise, we're going to do pursed lip breathing. So you're going to, this is the patient. So you're going to breathe in through your nose, take a nice deep breath in, and you're going to purse your lips together and breathe out for twice as long as you breathed in for, and then just keep repeating this. So the aim of the pursed lips breathing is to promote relaxation, control your breathing, and decrease how much the patient has to work. It's a technique that increases the amount of new air that is coming into your lungs and allows more control over your breathing.
So some warning signs of lung disease include chronic cough, shortness of breath, chronic mucus production, wheezing, and chronic chest pain. Some tips to keep your lungs healthy include preventing colds or respiratory infections by avoiding crowds, especially during the flu season, washing your hands frequently with soap and water, getting vaccinated for the flu, including COVID as well, and keeping your distance from others, especially when you're sick, and exercise or physical activity to keep your lungs healthy and prevent any progression of disease.
Next exercise we're going to be doing is diaphragmatic breathing. So I'm going to have Richie as my patient here. He's going to sit up, and I just want him to relax his shoulders, relax his head, try not to use any of these accessory upper muscles too much. And I'm going to have him place one hand on his chest and one on his stomach. I'm going to have him breathe in through his nose, nice and big, and you really want to focus on distending your stomach here. And then he's going to go ahead and breathe out through his mouth using the pursed lip method that we used before. Awesome. And as he does this, he wants to make sure that his chest isn't moving at all, so that's why your hand is here. And you want to make sure that the hand on your belly is moving outwards. So that's the reason for both of those hand placements. And as your stomach goes back down to normal, you want to try and contract those muscles a little bit as it goes back down, and that'll just assist in reducing the diaphragm back to neutral. And this is going to really help with stimulating that diaphragm that usually gets weakened when you're really trying to force the inspiration and expiration through these accessory muscles here. So we're trying to relax those and stimulate your diaphragm with this exercise.
Hey there, and well, thank you for participating today. So, just a quick wrap up of what we've gone over today. Just what we want you to take away from this video is, well, hopefully you learn some techniques that you'll be able to implement, especially when you're feeling some sort of exasperation with your breathing, or just will be able to implement this into your daily use. You just have a little bit better of a general understanding how the lungs play a role in your body, a better understanding of COPD and how it can be affecting those lungs, and what you can do to help prevent COPD from worsening in your own life, and what you can do to help manage that. Things we want you to be able to do and continue doing is try using this program and what you've learned, specifically the exercises to help improve your strength from your respiratory muscles, and maybe in the long run that could actually help make your breathing easier. Thanks.